Thank you for your courage to stand up and tell your story, because it's not always easy, I know. One of the reasons that we wrote the public option was not just for changing the insurance company rules, that they can't do things like that anymore, but I want the public option there to compete with them and basically force the compliance with those rules, because you never heard of anybody being thrown off Medicare for pre-existing condition or not, except, I mean, these government plans. Say what there's some people in this room that think government shouldn't have a very large role in our lives. That's a difference of philosophy. Me, that's fine. But we know Medicare worked, and we know for people for situations like that, the public option, if you choose it, or Aetna, probably either one, not advertising for Aetna here, to be sure, but any one of these would not let those kinds of things happen. The cost wouldn't be that high. They wouldn't be able to deny care. They would have to live up to a basic package of benefits. For any one of these private companies to be in the gateway, they're going to have to live up to a certain package of benefits. Again, approved by the government. Some people think government's too heavy-handed there, but frankly, I trust the government in this case, as they do Medicare, more than I trust the private insurance companies who have not done it. No, I'm sorry, gentlemen.
Senator Brown, I'm a Dayton supporter of you and the president. I think there really is a huge hole, and people don't see it, they don't think about it until it's too late. I think we obsess on bringing new people in, which we need to do, but this affects everybody. Perfect example, my father, 55 years old, never died with, I don't even think he's ever been on unemployment. Never got to Social Security. 55 dies, or 55 is diagnosed with late-stage liver cancer. Within a year, of course, almost immediately couldn't work. Couldn't afford COBRA. In less than a year, he was gone. 55 to 56. In that short amount of time, less than a year, everything out of pocket, he lost everything he ever had, spent every dime and owed. And that's why this is so important. Thank you.
Thank you, and I'm very sorry about your father, and thanks for sharing that. In the blue, yes. With microphone, thanks.
Senator Brown, we've had private insurance since the end of World War II, and we've come to a point now where we have only almost 50 million Americans without insurance. We have let the private system work. When it didn't work for seniors, former President Lyndon Johnson and the Senate and House in a bipartisan way put Medicare and Medicaid on the table. And now there are no seniors that go without health insurance. There used to be a time prior to 1965 where seniors didn't have coverage. And we solved that by putting a government plan where the private sector wouldn't play well. I want to really ask you to please make sure we have a public option. The private system has failed us. There aren't just anecdotes. There's real data. You can go and you can look at the data. People do not have options. The only option we're going to have is if we have a government plan. And people who want to beat up on government, you're beating up on veterans, you're beating up on military people, you're beating up on doctors and folks and school teachers and police officers. Government does a lot of good things in this country, and when the private market